Welcome, everybody, to the Age Hackers podcast. This is powered by Gladden Longevity. And on this podcast, we're here to basically help you answer three empowering questions. The first one is, how good can you be? It's really a global question. The second one is, how do we make 100 into 30? And how do we live young for a lifetime, as well as how do we live well beyond 120? I'm your host, Dr. Jeffrey Gladden, and we're going to have a conversation today with an interesting doctor, Dr. John Lieurance. He's a naturopath, a chiropractor, and he basically has written a number of different books. He went to Parker College Chiropractic. He did his naturopathic disease at St. Luke's Medical School. He practices functional neurology, naturopathic medicine, regenerative medicine, and he's developed some really interesting therapies. He's written several books. It's all in your head, endonasal cranial therapy. He also is really kind of an expert on things like melatonin and methylene blue. In fact, he has a book called Melatonin, the Miracle Molecule, and Methylene Blue, Silver Bullet. So I think you're going to find this conversation really, really interesting. We cover some really nice areas and some synergies between these different molecules, tying them into the aging process, the health process. I think you're going to love this conversation as much as I did. Welcome, everybody, to this edition of the Age Hackers podcast, powered by Gladden Longevity. I'm your host, Dr. Jeffrey Gladden, and my co-host, Steve Ryder, is off playing hooky again. I'm not sure what he's up to, but I'm sure something fun. Nonetheless, we're going to carry on here. Should be a great show. I'm really delighted to have with me Dr. John Lieurance, who is in Florida and has an interesting background as well as an interesting story and some really, I think, great therapeutic strategies that I want to introduce you to, and in some cases introduce and in some cases reinforce for you. So John, welcome to the show.
Yeah, Jeffrey, thank you for having me. I'm real excited to be here, and I think we're going to bring a lot of great content in this episode.
Yeah, I agree. So tell us a little bit about your background. I know that, you got sick. You were severely ill at one point in your life with Lyme and Epstein-Barr virus and mold illness. At what point in your life did all that sort of pop up?
Well, it really where I was in the peak of my physical condition, as far as, kind of how I see things, because I had gotten myself doing a lot of bodybuilding on my frame, 200 pounds.
Mm-hmm. How tall are you?
I'm 5'10" and a half.
Okay.
So at 200 pounds and zero body fat. I mean, I still really have very little body fat, but I was kite surfing, and you had mentioned you had a little thing going on with your paddleboarding before.
Yeah.
But yeah, I love to stay active. And at that point I was doing some really, really aggressive, kite surfing, where I was doing massive aerials and 360s. And then all of a sudden I found myself in just excruciating pain. It was like arthritic pain. And it
what
started.
Age was this?
I was 35.
Okay. So at 35, you would have finished most of your medical training. Is that correct?
Yeah. I've been practicing since I've been 26. So I'd already been in practice for about 10 years. Okay. And I had developed this practice that I had a lot of people flying in. One of the techniques that I use in my practice is an endonasal balloon adjustment. And it opens up the nasal passage in the airway, but it also helps to kind of activate a lot of brain wiring, and especially through the vestibular system, which can be really transformational when you're working on a lot of different neurological cases. So I was videotaping these cases and putting them on YouTube. And this was before Google and YouTube started really censoring natural wellness. So we were, I was on the first page and people flying to me from all over the world, and I'm getting all these people well with this treatment. And all of a sudden I get sick and I can't figure out what's wrong with me. And so I go to the medical doctor the rheumatologist, right? And they diagnosed me with ankylosing spondylitis.
Wow.
So then I'm diagnosed with autoimmune, but I was really like, no, it feels like I've got an infection. But none of the tests anybody had run up until that point really showed anything. But eventually I found out that there was Lyme, there was very high Epstein-Barr cytomegalovirus. And then later, way later, after I've, mostly gotten better, I found out the house I was living in primarily was full of mold right over my bed.
Okay.
So that could have actually been really the cause of most of it just in of itself.
There's really such good testing for Lyme and EBV and mold illnesses now that we have. And you're probably using some of the transcriptomic testing for Lyme also to kind of really look at where somebody is in the whole Lyme picture and actually decide whether they actually have Lyme or mold or actinomyces or whatever else. We've got a lot more precision to work with now than we did back then. And I think particularly if you're going to a traditional physician, I think a lot of that probably just went straight past them, if I'm not mistaken, particularly at that point. So
yeah, I feel oftentimes I'm like an investigator, right? And it's like you're looking for all these different clues, and sometimes you can find direct clues, and sometimes they're more indirect clues. On most of the people I work with, when I work them up through labs, I don't generally test Lyme right away, and oftentimes I don't find myself really testing people much at all, because if they have a lot of infections that are coming up in standard blood work, like the viral loads, and then they have a lot of inflammatory markers, and then specifically there's a marker called CD57 that I like to look at, and it's a T cell. If that's low, I'm just going to kind of assume, because I've done so much lab testing that at this point I can kind of navigate what's probable. And the treatment plans, which we're going to talk a bit about some of the different strategies we're using here in the clinic and how it might be appropriate for people looking to extend life and improve functionality during life. But these treatment plans are really very broad spectrum in the sense that they're really looking at the underlying life force of us, the mitochondria, because this is what happens when you get an infection. It's that cytokine, it's that inflammation that's shutting down our mitochondrial support. That's called the cell danger response. And those are primarily through endotoxins, these chronic infections, and then the toxins that they release are called endotoxins. And endotoxins are really rooted as a cause of most, if not, all diseases have some component of that involved.
Yeah, it's interesting. The cellular defense response is really fascinating. Robert Navino out of University of California, San Diego has done a lot of work in this area. And it's interesting that we think of mitochondria as being the power plants of the cells, which they are. But they also have this very important kind of sentinel sort of function that they have to basically detect when danger arrives. And so if we're being infected by a virus or a bacteria or something like that, they can sense that something's coming in and trying to hijack the system, so to speak. And so they go from being, elongated, big, robust factories to they break down, they break apart, they shut down activity, they decrease. And so it's one of the reasons that everybody feels tired when they get sick, is it's a natural body defense, this defense response, cellular defense response that the mitochondria have. And then as people are trying to recover from their illness, they move through several different stages of mitochondrial reestablishment of function, if you will. And it's the people that get stuck in sort of the middle phase and can't get out of it that actually end up with sort of the Lyme syndrome, if you will, or the mold syndrome. And of course, they have a genetic predisposition to that in the first place. But it's really interesting. So a lot of it, to your point, is how do we end up enabling people to recover mitochondrial function so that they actually, finish the healing process even after sort of the bug has been eradicated, even after you've treated with the antibiotic or whatever you needed to. So, it's quite interesting.
Yeah, well, that's fascinating. So I'm not familiar with this gentleman that you just mentioned, but it sounds like somebody worth worth diving into some of his material. Fascinating.
Yeah, it's really interesting stuff. Yeah, I can send you a couple papers if you want. But
Thank you. Yes.
But regardless, in your own sense, you got sick. So you're 35. You're kite surfing. You're in great shape, and all of a sudden you feel like you're getting arthritis. You're being told you got ankylosing spondylitis, which is a whole other, kettle of fish, so to speak, or can of worms, and so you dive down this path to figure out what's actually going on. So how did you solve this?
Well, I tested myself, and there was one other gentleman that was really doing some advanced work with viruses, and so he was the one that kind of ran a lot of the viral panels on me, and it was interesting. He made a comment. He said, "You got one of the highest Epstein-Barr I've ever seen," and this guy's in his mid 60s, and he's been working with viruses most of his life. So that was really, really like, wow. Right. I mean, so it really, when I look,
just for the audience, right? Epstein-Barr is like, it's like the kissing disease, right? It's like mono.
Yeah. Well, it's like 96, 97% infective rate in North America. So we all get exposed to it. We all get sick with it. And then, you never get rid of a virus, really. It's kind of hibernating, and your immune system keeps it at bay. But it can get reactivated. And it's involved with a lot of people's clinical picture, from what I'm finding, because I test for it regularly and I see it. Yeah. The way that we usually test for it is IgG, but, and what happens is you get these high IgG titers, and then many of the medical practitioners will kind of poo-poo it and say, well, that means you had a past infection. But when you look at people's history and you say, well, did you get really sick within the last year? Some people have and some people haven't. And then what do they feel like now? I mean, do you feel ill? Do you feel tired? Or there's some excessive inflammation in your body? So you have to start to kind of look at this. But when those titers get to certain levels, it really kind of is more so what they call acute chronic condition. So it's not a black or white thing. You really have to look at it from a few angles. But I've found most of the primary care doctors out there won't even really acknowledge it and just say, well, it was a past infection, which partly is true, but then I think deeper contemplations on it really reveal that a lot of people do have this that they're dealing with.
Right. Yeah, I think that's a good point. And so when you find that, then what's your strategy? And I suppose that this was part of your own strategy. Maybe you can talk us into that through how you kind of crack the code for yourself. How did you figure out how to fix yourself?
Well, the first thing I did was really just succumb to the full medical. I mean, I went on antivirals. Famvir was the drug that really this one physician had some success with it, and I did start to feel a little bit better. I mean, it was a long road, Jeffrey. I mean, this was years of work to get back to baseline, or even a little bit below baseline. And so
just
then
so the audience understands, I'll just interrupt you for a second, but just so the audience understands, when you take an antiviral like Amvir, what it really is designed to do is to decrease viral replication.
Right. So it blocks RNA.
That's right. It blocks the virus's ability to replicate itself.
Yeah.
It doesn't eradicate the virus from your body per se, but it does block replication. So that's why something like Xofluza can be so effective. You're exposed to the flu, you take Xofluza, it just shuts down viral replication. The next morning you wake up and you're fine. So these drugs can be very, very effective in the right context, but they're not perfectly effective, right? So, yeah.
Yeah. Well, I think there's better options for viruses from my perspective. Looking back now, I just don't think that there's as much research on a lot of these other answers like there are with the prescription, because when you're looking at things that have been gone through rigorous phase 1, 2, and 3 studies, I mean, there's a lot of data on it, and that's what our medical I mean, we like to see that, right? But then when we start getting into trying to see whether the cure is going to be more helpful to the overall organism, and not just give a temporary benefit, but yet long-term maybe not as good, which is the case for most antibiotics that I find, especially with chronic infections. And it's because this microbiome is so important. And when you're obliterating the microbiome, which, I know you wanted to talk about methylene blue, and this is a really, really shining example of something that's lost its patent. And so virtually lost its interest for anybody to really promote it. But like, if you look at urinary tract infections, there's really nothing better than methylene blue. And when you take it, you find you'll pee blue, and that's normal because it kind of goes through the body, but it inhibits a lot of the gram-negative bacteria, so it can be great. And so the methylene blue has very little downside. You can take it every day, and they call it the magic bullet. The word magic bullet was actually coined in the late 1800s because they were looking at methylene blue and they saw all of these amazing healing abilities to methylene blue, but yet they saw very little downside, if any, to the body. So it left the body completely unharmed. And there was everything from antimicrobial benefits to mitochondrial boosting benefits.
It was anti-malarial, if I'm not, it was used as an anti-malarial drug also.
That was the first discovery on the medical side, was they were staining bacteria, and they were and cells, and they were like looking to see, okay, now we're going to introduce these different compounds and see what was effective against it. And with the stain, they could see when things were getting killed and what was happening. But as soon as they stained the parasite that carries malaria, the parasite died. So they all of a sudden had their medicine.
They had their therapy right there. Yeah.
And it was used as the primary treatment for malaria until antibiotics came on board, and they were newer and they were sexier, and methylene blue patent ran out. And so then you had all of this extra money to then go and seduce the healthcare providers into a different route to go. And so now that there's a lot of strains of malaria that are antibiotic resistant, and there's a new resurgence in looking back at methylene blue because it does not build tolerance with methylene blue like it does with antibiotics.
Yeah. So how did this factor into your own recovery? Was methylene blue the first thing that you discovered in coming out of this? And I think, just to reiterate this for the audience too, when we talk about this use of these antivirals or antibiotics, it's one thing to kind of bring the bug under control. It's another to bring the immune system back into its kind of pre-infection state, bring it back into equilibrium, if you will, because sometimes the immune system, there's two branches, the innate and the adaptive immune system, and the innate immune system will keep firing even though the stimulus that made it fire in the first place is gone. And so being able to decrease innate immune system function becomes part of the solution. And then this mitochondrial defense response that we talked about is another part of the solution, where you have to, reestablish mitochondrial function so it gets back to where you have good energy production again. So it's kind of a three-pronged approach to clearing any infection, right? There's basically killing the bug or stopping the bug. There's getting the immune system to kind of go back into its state of equilibrium. And then there's making sure the mitochondria come back into their state of equilibrium. That's kind of how I think about it. But
yeah. And that's where, the point being is with antibiotics, unfortunately, because they have such a negative impact on your microbiome, and studies show it could be up to 2 years before there's a full recovery. This is where a lot of our immune system exists, is in the gut. And so if we obliterate our immune system, then we kill that load of whatever is virus, bacteria, but then yet we're left susceptible for reinfection. And that's what I've seen with Lyme, and even a lot of the medical approaches to viral infections versus some of the I think some of the herbal options, like Artemisa, I find to be really helpful for both acute and chronic infections.
Yep. I've had really good success with echinacea, quite honestly. You're feeling yourself coming down with some echinacea, zinc, vitamin C, Veracid, Humavir, things like this. You drop that in, the next thing you know, the next morning you feel fine. So I think to your point, a lot of the non-prescriptive remedies can be super helpful in that sense.
What I found to be one of the best hacks and best tricks for not getting sick is taking care of your doorways in the sense of the nasal passage. I talk about taking care of your doorways in the nasal passage, the mouth, and the colon as being the most common entry levels of these inflammatory endotoxins. And taking care of them, there's such a deep-rooted science in the literature showing how it's so detrimental to your health when you don't, and how beneficial it is when you do.
Yeah.
But I have a supplement company, mitochondrial, and we manufacture a number of different products. And one of the first ones I made was a glutathione, oregano, sage, clove, bay leaf. There's some colloidal silver, NAC, and it's a nasal spray called Glutastat. And when you're first starting to get sick, what happens is, like, these things are in the air and they stick to the biofilm in the nose, and then they can be carried into the bloodstream, especially if you have a lot of thick biofilm. It almost acts like a petri dish for a lot of these things to lodge into that cavity and then start to grow and proliferate, and then to enter into your body, into your bloodstream, and then go back towards the throat. The throat gets infected, and then it can drip into the gut and into the lungs. But if you can stop it here, which, another strategy for people at home could even be just a colloidal silver nasal spray.
Yeah.
But these essential oils are amazing at cutting down biofilm. And it's that biofilm that basically protects and hibernates those microbes.
Yeah, no, that's great. We've had good success with colloidal silver. I like your approach, though. I like the product that you've developed. That's nice that you've structured it that way. So again, back to you, 35, sick, years getting out. You came across what was the first thing you came across that you started to say, like, oh, this is beyond the antibiotic? What's the first thing that's helping you?
Well, probably when I first started getting sick, the thing that really helped me the most were high-dose glutathione suppositories.
Okay.
And I noticed I'd wake up and I'd feel halfway human, and that what's so amazing about glutathione is that it detoxifies your body. It helps support viral immunity. It's anti-inflammatory, and it's also in its reduced form one of the sleep promoting substances. So it's a really good product actually to take. When you're at night, it can really be beneficial.
Yeah. So you started to feel better with that, and then what about melatonin? Did that factor in for you as well?
So so basically, the glutathione, and then I found that intravenous ozone, intravenous silver, high dose vitamin C. I mean, had been doing a lot of those things kind of on and off. And then I was doing extended fasting, and I found fasting to be hugely beneficial. And so, but I'd gotten myself fairly in good shape. I mean, I was really, I would say, recovered, right? But yet I still had a lot of neurological complaints, memory, word finding. And that's when I did an internship with Frank Schallenberger out in Reno, Nevada. And he's kind of one of the original functional med doctors and brought ozone into the country. And I noticed that he was basically prescribing high dose melatonin to just virtually, most of his patients. I mean, he sees mostly cancer out there. He also sees some degenerative neurologic disorders, but I was able to get on his schedule as a patient because he had a cancellation, even though I was there kind of more as a student. And he kind of worked me up and said, John, I want you to start taking 200 milligrams of melatonin every night before you go to bed. And if you can tolerate it, take it during the day. And I want you to do this for, 3 to 6 months. And I never did start the daytime. but I did do the night. I still do. I still do several hundred milligrams a night, and that was a big turning point for me. And I found that this has been such an amazing tool for me with patients because it's so powerful at that deep cellular switch that we were just talking about, keeping the energy in the mitochondria in light of a lot of inflammation. And in today's world, we have so many stressors that are activating inflammation in our body that we never had to deal with, and it's just getting worse and worse every year. Yeah. So it becomes more important as we get older to be able to maintain our energy levels, and we lose melatonin very rapidly as we get older. And by the time we're 40 and especially 60, it's just you're not producing a lot, no matter how much you're going out in the sun and getting light in your eyes and complete darkness and doing all the different hacks for sleep and for
rhythm and everything. Yeah. Mm-hmm. Yeah. No, I think that's true. There's some interesting data on melatonin too. It is an anti-inflammatory. We tend to think of it as being a sleep. Really, it's kind of a circadian rhythm modulator or regulator on one hand, right? But then it's also an anti-inflammatory. We saw that in COVID. People with high dose melatonin would decrease that hyperinflammatory response that was generated by COVID. And then there's also some interesting data looking at the aging process itself, where in the hypothalamus, there's ventricle, and in the posterior lateral walls are stem cells. And those stem cells, when they start to age, they basically stop sending out exosomes to the body that keep it young. And so in essence, the switch changes from be young to get old. And some people hypothesize that this is actually, since the brain controls everything, that this is actually maybe the control switch for the whole aging process to sort of start, if you will. And it turns out that keeping those stem cells alive in the posterior lateral ventricle is done by having melatonin. So having enough melatonin actually keeps those stem cells alive, which can be good from the standpoint of staying young, decreasing the onset of aging even. So pretty interesting.
Yeah, well, what we're talking about here, Jeffrey, which is probably going to get people a little confused, is this is extra pineal melatonin, right? We're not talking about the melatonin in the pineal that's regulating sleep-wake. We're talking about that, wow, here we have a conversation about melatonin in a bunch of other ways that are not related to the sleep-wake cycle. And so
that's right.
It's not something that's really recognized. Every cell in the body produces melatonin within the mitochondria, right? And so when we age, there's more inflammation, and that inflammation results in poor mitochondrial function, and that could be partly related to the switching that's happening in the posterior lateral ventricles there. That's the first I've heard that. That's really fascinating about that whole concept and the exosomes.
Yeah, no, it's quite fascinating, actually. There's a paper that came out about 5 or 6 years ago that kind of highlighted this. So there's a guy, Shelley Jordan, who's at UCLA. He's a neurologist that we work with, who is the guy that actually introduced this to me, actually. And so we've had quite a few conversations about it. But it's really, really quite fascinating. So for the audience, when you're using melatonin in higher doses, you're actually obviously getting effects beyond kind of the effects that you would have at lower doses. And so you took this several hundred, 200 to 300 milligrams of melatonin, which is a lot. Like normally when people take melatonin for just sleep, let's say they might take anywhere from a half a milligram to maybe 5 milligrams, although dosing is incredibly individual. For some people, a half milligram is like, if they take 1 milligram, they can't wake up the next morning. They feel super groggy. For other people, they get 100 milligrams, they feel fine. So it's kind of, you have to find your own dose. But it is interesting that you were taking high dose. I just wonder, were you groggy when you started taking those doses or not so much, or what happened?
Yeah, in the beginning, the first few nights, I was a little extra groggy in the morning, but it wore off. This is, an interesting point with dosing melatonin. It's not the most straightforward nutrient to work with for healthcare practitioners, because there are some different outliers, and sometimes people will have paradoxical responses, which is an opposite response, where people will get kind of wired and even have insomnia when they take melatonin. And some people will have nightmares. Some people, they'll feel really, really groggy, and it'll be difficult for them to get out of bed and get moving the next day. We haven't, it's fair. The paradoxical and the nightmare is fairly rare, but it's more common for people to be groggy in the morning. And that has to do with us being able to metabolize the melatonin. So sometimes people metabolize it slower than others. And if that's the case, you can take the melatonin much earlier, even before dinner, say. And then by the time you're waking up the next morning, you've metabolized the melatonin. So then people might say, well, shoot, I'm going to be a zombie, during dinner and after dinner. Well, as long as you have light in your eyes, most of the time, it's not going to activate in the pineal, and we're not going to get that strong wake, that sleep signal. So it's not until we have total darkness that that pineal melatonin will kick in, and we'll be really tired.
Yeah, that's a good point. You can dose it earlier than you might think. It's not necessary. We think of it as a bedtime sort of supplement, but it's not really necessarily a bedtime supplement. You could take it in mid-afternoon, quite honestly.
One aspect of I know we had a short conversation before we started recording about most of your listeners are really looking at longevity and lifespan and having those healthy years while you're life. And, it seems really, really clear that we have to have the ability to rest. And if we can be if we're going to exercise, maybe like marathons might not be the best thing, and it might be better to do like sprints, right? So it's like low duration. So we want our body to have that stress, but we want our body to be able to be at ease and have more relaxation than I think most people are able to have in these days, right? I mean, people are working fairly long hours, right? And a lot of people might be exercising or over-exercising. And so it's this aspect of the sympathetic nervous system and the parasympathetic nervous system. And the sympathetic nervous system is going to be really activated when we're busy and we're doing a lot of things. And it's not unless we're kind of like chilling, we're relaxing, we might be sitting around talking to some friends and not really super active, that the parasympathetic nervous system really kicks in. And the primary activator and supporter of that parasympathetic nervous system is actually melatonin.
This episode of the Gladden Longevity Podcast is brought to you by H2 Molecular Hydrogen in the Gladden Longevity Store.
Yeah, Steve, you've heard us talk about this numerous times on the podcast in terms of the benefits of H2 and hydrogen water. We love it. It's really the best way to balance your entire redox system. So it really protects you from free radical damage. I take it every time I get on a flight to protect me from radiation damage when I'm flying. And I use it to rejuvenate my brain in the afternoon. There's really two kinds of exercise. There's physical exercise, and taking H2 before or after that works great. But also there's mental exercise. And I find that the H2 will bring your brain back when you're tired in the afternoon. So I think it's like the perfect thing for longevity and for performance, quite honestly.
And I talked to you about this, that I found dropping 1 or 2 tablets in a glass of water right before bed. I've seen an overall bump in my deep sleep when I do so. And
fascinating.
Yeah. So if you click on the store tab when you visit GladdenLongevityShop.com and use the promo code podcast10, you'll get 10% off your order. And this code isn't only good for our H2 product, but it's also good for all the supplements we carry. So podcast10 at the GladdenLongevityShop.com.
Yeah, one of the other things that I use it for routinely is when I'm about to go on a mountain bike ride. And I will say this, that if I go on a long mountain bike ride, I will take one prior, I'll take one during, and I'll take one after. And some of the Ironmen that we've worked with have said that when they're doing an Ironman, they'll take it 3 or 4 times throughout the race. And their comment is that it's like taking out the old battery and putting in a new one. It really rejuvenates your body's ability to perform when you're doing more extended athletic activity. So think about that too. If you want to go do a longer hike or whatever else, take it with you.
So GladdenLongevityShop.com, enter podcast 10 for 10% off your order.
H2 molecular hydrogen. It's low-hanging fruit on your quest to make 100 the new 30. Yeah, I think the audience is very familiar with the autonomic nervous system, parasympathetic, sympathetic, HRV. We've done lots of shows talking about this and measuring it, monitoring it with, Oura Rings, Whoops, Apple Watches, Garmin's, all these different things. It's become pretty mainstream to be able to do this. And a lot of people are looking for ways to augment their HRV, which is, in essence, basically increasing their parasympathetic nervous system tone relative to their sympathetic nervous system tone. And so what you're saying is that taking more melatonin or even higher dose melatonin, or maybe a higher dose than you might think you can tolerate, but taking it earlier in the day may have a significant impact on your HRV. That's kind of what I'm hearing you say. Is that?
Oh, the HRV is hugely supported with melatonin, especially the higher dose, higher dosing of it. And why are we going with higher dose? I mean, Dr. Schallenberger was really kind of going off of Russell Ryder, who's a PhD and MD, is probably one of the most savvy, educated, research doctors on melatonin. I mean, since the 60s, this guy's been doing. He was the one that originally discovered the pineal wasn't a worthless gland.
Okay.
That it actually served a purpose. And so Russell Ryder takes, hundreds of milligrams himself. And some of the arguments against taking higher doses of melatonin would be that it would shut down your normal endogenous production of melatonin, but there's no negative feedback loop with this particular hormone.
That's right.
It's 100% based on the amount of light that hits your iris, right? And so if you're out in the sun and you have sunglasses on, you might be thinking twice about the benefit of that with regards to how it's going to affect your melatonin levels.
And so this is a good point you make. This is a really good point that because I've had people say to me, well, if I take, this melatonin, it isn't going to stop my own production. Like if I take testosterone, it isn't going to stop my own production. Yes, with testosterone, but not with melatonin. It's different.
Not with melatonin. Yeah.
So that's quite interesting.
Did you know that there was a crop circle in England, like a legit crop circle that was the identical molecule of melatonin?
No.
And there's so much of things coming on with whistleblowers and with extraterrestrials, and I've been kind of interested and involved with this through a buddy of mine, Emery Smith, who was a host of a show called Cosmic Disclosure.
Yeah.
And he's always telling me that there's some very, very beautiful, loving, intelligent beings that have been occupying and visiting us. And I think last year I saw somebody post this crop circle of melatonin. And I really feel like just for that one fact that there's no negative feedback loop with it, that we can take it and that it works on the core energy aspects, that there's just something really, really amazing and unique about this molecule.
Have you had anybody talk to you about sort of a decrease in short-term memory taking melatonin? There are some papers that have been written about transient decreases in short-term memory with melatonin use, and I'm not sure what the physiologic link is to that, but I'm just curious to ask you if you've seen that, read that, heard that.
Every single time there's been something somebody's brought up, and I'll give you a couple of examples. They'd be referencing a study that says this or that might be bringing pause to, should we be supplementing melatonin? There's always a major flaw to the study. And if I can't figure it out or see it, I'll usually fire it over to Russell Ryder and he'll be able to point it out. This is one I'm not familiar with, so I can't speak to it. But I could speak to, there's like Andrew Huberman is, he's got a huge presence and voice. and he's not a fan of melatonin supplementation. And his main objection is that it has been shown with rodent models to suppress testosterone. And what you have to understand is that these rodents are nocturnal, and they're also their testosterone is linked to seasons, and it's linked to you have shorter and longer days. And as you go through the season, there's variations to that, and as it's related to the testosterone. And so when you look at this particular study, it's just the physiology that these rodents have. And so if anything, there's been a tremendous amount of studies showing that high dose melatonin or even melatonin, it actually protects the cells in the gonad, and it increases fertility and improves sperm production, all those things. With the other,
you can't always transpose from a rodent model into the human, right? I mean, it's part of your point, I think, here. So, yeah.
Well, so Jack Kruse has an argument too with the retina, and there's an idea if you take melatonin, your retina is going to be more susceptible from damage from the sun. But he's referencing a study with rodent models as well, and they were albino rodents.
Okay.
And also, not a lot of people, maybe there's a possibility if you're taking melatonin during the day and you get a lot of light exposure into your eyes, there might be some concern there, but that's not how people are taking melatonin. So to basically just have this global negative thought process on supplementing with melatonin based on that one study just doesn't make sense. The truth of the matter is I'm out in the sun a lot. I'm in sunny Florida. I surf, I go out boating, and I can be out in the sun all day long and I will not burn. If I wasn't taking melatonin, I would burn to a crisp, but it's protecting my skin. And I've seen redheads come to me from up north, and they come down and they forgot their sunscreen. They go out fishing all day, but I got them on a couple 100 milligrams of melatonin, and they come back and they can't believe it. They're like, I'm not even burned. Mm-hmm. So it's hugely protective to the eyes. It's hugely protective to the male reproductive systems. It's hugely protective to virtually every part of your body, because it's the ultimate stress resilient molecule. When the stress hits, the inflammation goes up and the energy goes down, right? So it's our ability to adapt to stress. And if we are to adapt to stress, we need the energy to do so. But if the stress exceeds our adaptation threshold, then you start to really run into accelerated aging and to injuries and to arthritis and to all kinds of different things that are damaging to the body.
Nice. So let's talk a little bit about methylene blue for a minute. This is an agent that we were talking about previously, and its antimicrobial effects and some of its anti-malarial effects and things like that. But let's talk about it a little bit more from the standpoint of optimizing mitochondrial function, some of its benefits for optimizing cognitive ability, brain dysfunction, potentially preventing and treating neurodegenerative disorders, things like that. It's a pretty fascinating molecule. I think we should talk some more about that. I know you know a lot about it.
Well, as we age, there's this whole thing where we can accumulate proteins, right? With Alzheimer's, it's beta amyloid plaque. And there's these neurofibrillary tangles that start, which really goof up the nerves. And Parkinson's, you have alpha-synuclein, which Parkinson's becoming more and more common. So these degenerative neurologic disorders are really a response to inflammation in the brain, and it's some sort of a toxic exposure. And the proteins are there to be protective. So they kind of wrap around these different things to stop the activation to the immune system, to the glial cells, which then causes a lot more damage. And so we have this area in our brainstem that's called the locus ceruleus. And the locus ceruleus, it means blue spot in Latin. And there's a connection with our trigeminal nerve, which is our nasal passage in our mouth, because it innervates the whole face, to that area of our brainstem. And the research is showing that a lot of these neurofibrillary tangles and these beta amyloid plaques start in the locus coeruleus and actually move up. And it precedes even stage 1 of Alzheimer's. So it's way, way early. It starts in that locus coeruleus. And so the locus coeruleus is, I think, an area of the brain that really can be quite interesting to look at from a lens of longevity and health span and lifespan. And methylene blue works really well within this area because it's so metabolically active. And I know I'm kind of like taking the scenic route to answering your question about methylene blue. But the fact that this area of the brain is called the blue spot, and we're talking about methylene blue and how it might support that area, I think is really worth.
So now we've just added to the blue zones, right? So there you go.
And then you got blue zones, right? Are you in a blue zone?
I'm not. Well, I'm energetically in a very interesting space here in Puerto Rico. I'm at the beach, and I have the El Yunque, the rainforest, right behind me. So we have the cleanest air on planet Earth here, actually.
Wow.
Yeah, because the trades are coming from the east, and so that's just wide open Atlantic Ocean. Sometimes we'll get dust from the Sahara, but you have the rainforest, right, with all the energy that comes out of that, all the rain, the oxygen that's generated. You got the ocean right in front of you. It's kind of when you get onto this property, you feel it. I mean, if you're energetically inclined, you feel like, oh, okay, this is a different energy here, right? So yeah. So I don't know if it's a blue zone or not, but it may be a blue neighborhood. Who knows?
Yeah, it has the potential. It has the potential with all that clean air and that beauty. Yeah. So circling back to methylene blue, I know you originally kind of asked me about methylene blue. It's an industrial dye, and the way that it works with the mitochondria is unlike any other molecule that they've ever seen, since it has this like almost catcher's net part of its molecule that can accept and donate electrons.
Methylene blue is an interesting molecule. It has some unique abilities to work on the mitochondria.
Yeah, so there's this like ring structure on the molecule that allows methylene blue to donate and accept an electron. And so methylene blue has an affinity to mitochondria. So this is one of the reasons it makes a great dye for looking at nerve or different tissues that are more metabolically active because they have more mitochondria. So they'll accumulate in there. And so when you add methylene blue, it stains it more dark blue. So it goes into the mitochondria, it finds its way into the mitochondria, and then it acts as both an electron donor and an electron acceptor, which almost turns the mitochondria into like some sort of a superconductor. And so it allows the mitochondria to have about a 30% increase in its ability to make energy, which is huge.
And so this is kind of like, it's almost functioning
the
like
fourth
NAD,
complex. So within the mitochondria, you've got these 4 kind of protein complexes, and they're all named based on, complex 1, 2, 3, and 4. And number 4 is called the cytochrome C, and cyto is cell and chrome meaning light. And so when the methylene blue gets into that complex, it's absorbing red and it's reflecting blue, because that's what methylene blue does. That's the colors are usually absorbing the opposite.
Sure.
And so it has the ability to absorb that photon. So we can use either photons or electrons to make energy. So methylene blue, if it's used and it's in conjunction with someone getting out in the sun or using like some of these red light panels like the Mitolight or SaunaSpace, which is using more incandescent lights, but they need to be red lights in a certain, like generally about 660 nanometers. Here in the clinic, Jeffrey, we'll actually do intravenous methylene blue and then use an intravenous laser where we can just basically irradiate the entire bloodstream. And this can be really, really powerful. And so then basically you get this accentuated effect with the methylene blue.
Right. And methylene blue, it can be given IV, but people can also use it at home. this is something that people can take at home as well. You want to talk about that a little bit?
Yeah, actually, methylene blue is fabulously absorbed orally. Not all nutrients are like that. Like melatonin, only 2.5% of that molecule is absorbed orally. But with methylene blue, it's very well absorbed. We like to prescribe it in this little bar. It's called Lumitol Blue. And basically, it comes in these squares, and you cut it and you can take it and throw it in the back of your throat and then drink something down so that your mouth doesn't turn blue. The sublingual delivery system is not really a very good way to absorb, because it actually the stomach acid actually enhances the absorption of the methylene blue. The dosage can be a little bit different for everybody, and it kind of depends on what you're looking to do with it. I would say if people are kind of in fairly good shape and they're not having a lot of stress in their life, 15 to 20 milligrams a day. Some people say you're crazy not to take this every day because of its neuroprotective ability. So even if it's like this idea that I want to protect myself in case I get a heart attack or a stroke, boy, a little bit of methylene blue in your system could really go a long way. Same thing with melatonin. But
so methylene blue is interesting. Just so the audience understands, it will stain. So if you take the liquid, let's say you have a dropper full of it, and you put it in your mouth, you're gonna have a blue tongue and some blue lips and some blue cheeks for a while as you swallow it down, right? And and actually, to your point, I think you mentioned this earlier. You're gonna pee blue too. And there are some people that have taken enough that you can actually sort of start to see a bluish tinge to their skin almost, I've seen. So just kind of be aware of that as you use it, but it can be very powerful.
Are you sure those weren't people that were taking a lot of silver? Maybe they were combining the silver and the methylene blue, because actually silver mixes very well with methylene blue and enhances its photodynamic capacities, and so does gold. I haven't really found a lot of good quality sources for gold supplements, but I certainly do recommend patients take silver at the same time.
Yeah, I'm not aware of silver augmenting the blue element of it, but are you saying that using silver would augment both its antimicrobial function as well as its pro-mitochondrial function? Is that what you're saying?
Yeah, exactly. Perfect.
Interesting. Fascinating. Okay. Was not aware of that. Very cool. So this has been kind of a really fascinating conversation. And I like the idea of using red light to actually augment the methylene blue too. So now we've got silver as kind of an adjunct or augmenter of methylene blue, and then you've got red light therapy, either with a laser or external red light therapy is what I'm hearing.
Yeah. Some people even say a little bit of vitamin C, 2, 3, 4, or 500 milligrams of vitamin C even, when you dose the methylene blue can help.
Okay.
One thing is also, we didn't get a chance to really talk about how methylene blue enhances autophagy. Okay. And they've actually found methylene blue is very powerful at clearing a lot of these protein tangles. And I think if you really think about it, it makes sense, because if indeed these protein tangles and these degenerative neurologic disorders are more related to chronic infections or potentially leaky blood-brain barriers, letting things that are inflammatory into the brain, and then the brain wants to encapsulate them and protect. It makes sense, because methylene blue really works to improve, those things. It will strengthen your blood-brain barrier just through bringing down your microbe load and enhancing mitochondrial function. But then being able to deal with some of the infection systemically and neurologically, methylene blue is shown in studies to be very beneficial. In fact, even for the last pandemic, I had a colleague that did studies showing in 2 days with methylene blue and red light, he could eradicate COVID. And he took this to the FDA, and the FDA was so this is the thing, though, that we're now finding out, that in order for them to have kept their emergency use authorization, there couldn't be any other solutions to the virus, right?
Yep.
And so that's kind of explains why everything was squashed. Vitamin D, high dose vitamin C, ivermectin. I mean, you look at all the different options. And even me, I was like really preaching melatonin. I wanted to go to Washington, D.C. and sit down and just like, guys, we need to get everybody on melatonin. I mean, there was studies coming out showing that it was even suppressing the transmission of that virus, a Canadian study, by 54%. But there was no interest. And so,
right. So I just found a paper. I just found a paper, to your point, on methylene blue inducing autophagy and decreasing tau protein. With Alzheimer's, there's beta amyloid that builds up, but then there's tau protein as well, right? So,
right.
And so it actually attenuates the formation of tau, but it increases autophagy, induces autophagy. So that's really interesting, because autophagy is one of the hallmarks of aging, right? It used to be kind of harbored under proteostasis per se, but now it's its own hallmark. And it turns out it's actually one of the more central hallmarks. Being able to upregulate autophagy turns out to be one of the really crucial things that you need to do from a staying young sort of strategy. So being able to use methylene blue in this case to both improve mitochondrial function, I wonder if it increases mitophagy. Do you have any data on that?
That's a great question. I would assume there's going to be some level to that. But, I tell you what, the best strategy for mitophagy, hands down, is ozone.
Oh, sure.
You're activating that PGC1 alpha pathway.
Yeah.
Nothing better.
Yeah.
And especially ozone in a fasted state.
Yep.
Which is what I did today. You caught me when I was moving around. You saw the IV I've got in my arm. So today's my ozone high dose vitamin C IV day.
Got it. Okay, cool. Well, I did find an article on mitochondria as a target for neuroprotection, the role of methylene blue in photobiomodulation, which is kind of what you're doing.
Mm-hmm.
I
think we ought to talk a little bit about just, you don't want to just go get any methylene blue, right? Methylene blue can be
you don't
toxic.
Want to get industrial. Yeah, you want to get medical grade methylene blue, right? You're not going to go down to industrial methylene blue. It can be toxic.
You want a good source for it.
Yeah.
Mm-hmm.
Talk about the
and
toxicity.
Then the dosing is usually between 0.5 milligram to 4 milligrams per kilogram of body weight.
Mm-hmm.
And you don't want to go super high if you're on an SSRI, but what you might find is that the methylene blue may be a better cure for depression than SSRIs are. And of course, you're going to want to talk to your doctor before that. But a lot of doctors are leery of prescribing methylene blue because of their interactions with SSRI and the fear of something called a serotonin storm.
Right.
And so that is a little bit overinflated based on Francisco Gonzalez Lima, who's kind of considered one of the more authoritative figures with methylene blue. He seems to feel like, it would have to be much higher doses than what people are normally taking. And that a lot of that warning was based on just a few cases that were getting a thymectomy surgery. And so there was a retraction of that warning by Mayo Clinic and also by the whole country of Canada. But you do have to be looking at that. I think if you're within the lower dosage, that you could potentially utilize methylene blue as a strategy for depression that might actually fix the depression at its core, which is where it's a chronic infection. And that chronic infection is activating nitric oxide to be elevated. And that nitric oxide is what activates the depression. They've done studies where they've shown that very clearly. You raise nitric oxide, there's depression comes in, you lower it, and the depression goes away. And of course, this inducible nitric oxide, when it's excessive, this is what the immune system uses so it can like bring in blood to areas and vasodilate to get immune cells into infected areas, swelling.
Yep, exactly. Yeah, there is data. There are papers here looking at its use in treatment of psychotic and mood disorders, also used as a memory enhancer. And
the memory enhancer is really, really interesting. And that's where we kind of go back to the blue spot on that, because this is where we store all of our short-term memory during the day. And then that memory needs to be consolidated into our long-term memory. And this only happens when we're in REM, right? And so if we're not getting good REM sleep, then we're not consolidated our memories, which is allowing us to kind of make sense of what happens from a day-to-day standpoint with what we know and what we've experienced throughout our lives. Mm-hmm. And so this is very rooted in ruminating on things and depression. In fact, the locus coeruleus and the blue spot is looked at as a very important structure with regards to depression, anxiety disorders, memory issues, right. And the development of a lot of degenerative neurologic disorders.
Let me just read this for a second. This is from a paper called Methylene Blue in the Treatment of Neuropsychiatric Disorders. And it says, particularly promising results have been obtained in both short and long-term treatment of bipolar disorder. In these studies, methylene blue produces an antidepressant and anti-anxiolytic effect without risk of switching somebody into mania. And that's a big deal because it's difficult to treat bipolar. And many times, things that we think can be good, we're worried about it triggering mania. So the fact that it can treat anxiety, depression, psychosis, and you can actually use it in people with bipolar disorder and not fear switching them into mania, that's also a very cool piece. So,
well, the brain is, you have like excitation or inhibition, right? I mean, this is kind of the two paths that it takes. And so oftentimes when the brain goes south, we lose the inhibition, right? And so the locus coeruleus is the primary management area for noradrenaline in the brain, right? So this is the gas pedal. And what happens is a lot of people can't pause that. They can't calm it down, and that goes back to our conversation earlier where, I think most people that's too adrenalized, we're staying too busy. We haven't really learned how to deeply relax. And in order to allow that locus coeruleus to pause so it's not sending information to the brain to produce noradrenaline, you have to live life in a certain way, and you have to have a strong mitochondrial support, right? So when the mitochondria goes down, you have this super metabolically sensitive area in the brainstem. It's in the pons called the blue spot, and there's not the energy to it for it to pause. And so it's going to be like pulsing, right? And so it needs to go down to a frequency of 1 or less in order for this whole memory consolidation and all these magical things to happen. Otherwise, it's activating all these other parts of the brain to be adrenalized, right? Yeah. That's where you get the anxiety and you get, a lot of different disease patterns associated with that.
Yeah, exactly. No, it's fascinating. I think there's a lot here. And I like the way that you're layering this together. What I'm kind of hearing is, methylene blue, melatonin, silver, ozone, red light, all these things kind of synergistically are working together, fasting in terms of helping to optimize autophagy, basically treating anxiety, depression at the same time. They're also boosting cognitive ability and decreasing the risk of neurodegenerative disease. So it's really, it's kind of like a multifaceted win for
it's all coming from the same place. If you look at virtually every neurologic disease, these people have anxiety, they have depression, and so these things
start from it all. It's all coming from the same place.
Well, yeah, it's all if you look at all of these different neurologic conditions, virtually all of them have depression and anxiety in different types of psychiatric components to it. Yeah. And so when you're thinking of, wow, well, this strategy works on that primary disease, but it also works on the depression and anxiety. But ultimately, like, we're really working on that core aspect of the condition, which is so unique because in modern medicine, so often they're focusing on things that are downstream, and
That's right.
and this is just, it's just the problem. I know I hear a lot of people talking about, because we've talked about these different protein tangles, and looking for drugs that are just going to dissolve these proteins is really silly, because you're not honoring what's really happening in the body that's leading to that, right? It's just an individual looking for a paycheck, and to get people on something that they'll have to take for the rest of their lives.
No, it's such it's really such a short-sighted approach. It's all based on the symptom-driven kind of scenario where we find a marker, we're going to lower that marker, that'll be the solution. It's like, it's never the solution, right? It's all about understanding what's generating it in the first place. And that's what's nice about what we've been talking about for the last hour, is kind of getting down to some of the real basic biomolecular pathways that impact not only health, but longevity and everything else. So that's been very, very cool.
Well, one really interesting fact too is because we've talked about this locus coeruleus, this blue spot, a few times, and SSRIs will actually block the blue spot from pausing. And so that's one of the negative aspects of taking SSRIs, is that we aren't able to really completely slow down, and people start to get some benefit because they'll get a little more energized because they're getting that noradrenaline effect through excitation of the locus coeruleus, but they're not able to like pause it during REM, which means that they can't do memory consolidation. They can't start to like make sense of things going on. And that's why they don't work. And that's why you see all of these commercials where people are saying, well, if your current medication isn't working, then try this or add this to your regime, right? Because again, the real root cause, I'll go out on a limb because I really firmly believe this, but it's a chronic infection. It might be Epstein-Barr. It could be anything, but there's some level of chronic infection. It could be an infection in your jaw, could be an infection in your mouth, in your nasal passage. It could be your in your gut, so it could be dysbiosis. But at the end of the day, it's that infection releasing endotoxins, and it's this whole aspect of the nitric oxide, which is an inflammatory byproduct. And this gets into the brain. This causes a lot of degenerative neurologic disorders. So let's step back and start thinking about how can we take care of our doorways? How can we start finding those areas that are infected in our body and start addressing those as a strategy for life extension? Because you could be taking the most expensive things in the world and flying all over and getting stem cells. But if you're not addressing some of these basic, basic aspects, then you could be really missing some low-lying fruit. Agreed.
Well, I want to thank you for coming on the show. A fascinating conversation. I think it was really, really good. So again, appreciate your time. Thank you so much.
Yeah, Jeffrey, my pleasure. So if anybody wants to find me, I'm on Instagram at Dr. John Lieurance, and we have a clinic in Sarasota, Florida, and it's at advancedrejuvenation.us. And I'm also the science advisor of a supplement company called mitochondrial, and we're a club-based company, and we make rectal delivery of a lot of different nutrients. We have some methylene blue, we have high-dose melatonin, we have liposomal, we have different nasal sprays. So a lot of very kind of unique and novel types of supplements. We have a fasting protocol called Fast Track Fast. We have a Ganesh kit, which is taking care of your doorways. So I talk a lot about what we've talked about today, and we educate people with the site. It's a $10 lifetime membership fee, but we have a lot of education that we provide for our members in the back end. So, but Jeffrey, thank you for having me on your show. Really appreciate it.
Yeah, happy to have you here. And just so people know, Lieurance is spelled Lieurance. So that's Lieurance, John Lieurance. So you can find him that way. Good. All right.
Well, Thanks. It's French, so it theoretically Lieurance, but
Lieurance. Okay.
most people just say Lieurance. So thank you.
We try our best.